Now at 5, nurses across the state are calling for change they say will help their own well-being and the well-being of their patients. They rallied at the Ohio Statehouse today. They support a bill they say would help increase their numbers and relieve their job stress.
This as a nursing shortage affects hospitals, nursing homes, and other facilities nationwide. 10 TV's political reporter Doug Petticash is live on Capitol Square tonight with the message they delivered today. Doug.
Well, Andrew, they rallied right here, and that message was that understaffing equals a patient care crisis. They say there aren't enough nurses, and the stress of the job and the overwork are forcing many nurses to leave the profession. The father of one nurse says for his daughter, the stress of the job and depression became too much to bear.
It's difficult. I was the one that found her.
Ron Smith's daughter, Tristan Smith, died by suicide last August at the age of 28. She was an emergency room nurse at a hospital in the Dayton area. He says the stress of her job affected her mental health, and he had tried to talk her into quitting nursing.
I told her, I said, Tristan, if you are crying before you're going to work because you don't know what kind of night you're going to have, if you're physically getting sick before you go into work, we need a different career here.
Now Ron is advocating for change.
I'm here today in memory of a cherished life lost.
He shared Tristan's story at this nurses and healthcare professionals rally at the Statehouse. Ohio Nurses Association President Rick Lucas says they support bipartisan House Bill 285. It would mandate minimum nurse-to-patient ratios in hospitals and create a loan-to-grant program to recruit more nurses.
For years, hospitals have been understaffed, leading to overburdened healthcare workers that are leaving the profession, leaving the bedside in droves.
A study in early 2023 by the National Council of State Boards of Nursing found around 100,000 nurses nationwide have left the profession since the COVID-19 pandemic. The bill's co-sponsor, Representative Elgin Rogers, says it is about retaining and recruiting nurses, but also about the patients.
We want to make sure that patients have the staffing ratio so we can take care, the nurses can take care of our loved ones.
Co-sponsor, Representative Haraz Ganbari, says the Ohio Hospital Association acknowledged to him the challenges with nurse staffing, but believes hospitals need more flexibility with their own ratios.
What they've shared with me is this is an issue that they've been working on for some years, and my response is it hasn't gotten us to where we need to be right now.
While his heart aches over the loss of his daughter,
what do we want? Free staffing! When do we want it?
Now! Ron Smith says he'll pour his energy into the cause.
My role right now is to support this bill and get this bill passed.
I reached out to the Ohio Hospital Association. They sent a statement saying that they oppose House Bill 258 and the impact it would have on hospitals' ability to provide care. It says in part, per Ohio law, Ohio hospitals develop nursing service staffing plans by organizing internal committees of caregivers, including nurses, to make recommendations for staffing levels that provide both a safe working environment for employees and quality health care for patients. It goes on to say mandated approaches to nurse staffing limit innovation, reduce the flexibility needed to respond to patients' changing care needs, and increase stress on a healthcare system already facing an escalating workforce shortage. The association spokesperson also pointed out that there are 24,000 job listings for nurses on the Ohio Means Jobs website. Live at the Statehouse, Doug Petcash, 10 TV News.